Good evening and welcome everybody. Thank you very much for joining us. My name is Alec. I'm the Managing Director for Wound Care People. Tonight we've got a really special event for you in partnership with the QNI, so the Queen's Nursing Institute, and it's called Nursing Students, the Community and You. We have three absolutely amazing speakers. We're really pleased that they've agreed to work with us on this event. And they are Liz Fenton, who is the Deputy Chief Nurse for Health Education England, Sam Sherrington, the National Head of Community Nursing, the Nursing Directorate for NHS England and NHS Improvement, and Dr. Crystal Oldman, who's been with us before, and Dr. Oldman is the Chief Executive of the Queen's Nursing Institute. So, as always, you'll see, or certainly over the last sort of 15 or 16 months, just a bit of housekeeping from me. You'll see that we're presenting remotely, so please do bear with us if there are any technical difficulties. As always, slides and certificates will be available at the end of the presentation. And if you do have any questions, please do put them into the chat section next to the actual presentation. The more questions we get, the better the event will be. So please do ask as many questions as you possibly can. I'm going to hand you over now very shortly to our speakers, but just very quickly, Liz, Sam, Dr. Oldman, how are you feeling? Are you ready for the presentation this evening?
Yes, great. Thank you. Looking forward to it.
Brilliant.
Yeah, fantastic.
Ready? Yeah.
Brilliant. Well, I know that you're all very excited about this. So without further ado, Liz, I'm going to hand over to you. After the presentation, I'll be back for the live Q&A. So as I said, please do ask as many questions as you can, because this is an event for you. And the more questions we get, the better the Q&A will be. So I will see you after the presentation. Over to you, Liz.
Thank you. And hello, everybody. My name is Liz Fenton. And as Alex said, I'm the Deputy Chief Nurse at Health Education England. I'm really thrilled to be with you this evening. I'm really proud to say that I'm a Queen's nurse, and this year will mark my 40th year as a registered nurse, and I've spent a significant part of that time in a variety of roles, working in community settings, both in health and social care. Health Education England is delighted to be working with the Queen's Nursing Institute on this event, as well as on our shared work to develop resources that can provide information and support to students and others who are preparing for or taking up placements in the community. So who are Health Education England? We're part of the NHS with responsibility for workforce and education. We work with our partners to plan for the future, to ensure we've got the right workforce in the right place, with the right values, behaviours and skills to meet the changing needs of the people in England. And that covers 350 roles, including all branches of nursing, midwives, doctors and paramedics, to name just a few. But we can't do this alone. And we work really closely with education providers, employers, and those that support practice placements, as well as our key partners such as NHS England, the Council of Deans for Health, the Nursing and Midwifery Council, and of course the Queen's Nursing Institute. We also keep a really strong focus on the quality of the learning experience and the practice environment through our HEE quality framework. Some of you may have contributed through the National Education and Training Survey. That provides us with really valuable insights from the lived experience of learners in practice and really does inform our work. I'm sure you'll all know just how important good practice-based learning is. We know it enables the development of knowledge and clinical competence, as well as building the confidence needed to practice effectively. But more than that, we've learned from our work looking at retention that a positive experience while on practice placement influences the choice of the first place to work after graduation. This really importantly brings talented new registered nurses into our health and care teams. I really welcome this opportunity to have a focus on nursing in the community. So often we hear about community as if it's a single entity, rather than a huge range of learning and career opportunities. Practice learning can be gained across all 4 branches of nursing and midwifery and in a variety of settings, and they provide a wealth of learning opportunities. It's fantastic to be able to shine a spotlight on these opportunities and share in this conversation. And now I'm going to hand over to my colleague Sam, who I'm sure will introduce herself to you.
Thank you, Liz. And hello, my name is Sam Sherrington. I am the National Head of Community Nursing in the Nursing Directorate at NHS England and Improvement. And I'm so delighted to be here and speaking with you about nursing students, the community and you. I am a very proud district nurse with a specialist practitioner qualification and I am a prescriber. I fell in love with community nursing as a student nurse. I continue to work clinically and now have an honorary contract locally in community nursing in my hometown of Bolton in Greater Manchester throughout COVID. In addition, I have been so pleased and proud to visit and work alongside many community nurses in practice across England. During these visits, and indeed during my clinical practice locally, I have worked closely with many student nurses, all of whom have been so inspirational in their approach to learning and development, especially in the pandemic. On the slide here, you will see my Twitter handle and that of Team CNO, a family to which all nursing students in England are welcome to belong, and our email contact details. On the left of the slide, you will see a community nurse working to deliver care at night in all weathers, including the snow, supporting the health and well-being of our patients and families and communities. Community nursing is all around us. We are a huge family across communities in England, covering all age services across the life cycle. Community nurses work in people's homes, in care homes, in schools, community centres, clinics, on the streets, in pop-up places, in police cells, hostels, and such a variety of places. Community nurses work in NHS trusts, in social enterprises, charities, local authorities, social care, education and schools, primary care, a huge community nursing family of more than 86,000 and still counting. Here are 2 community nurses. Ruth on the left is a children's community nurse in Bedfordshire Community Health Services, and Rachel is an adult community nurse working evening and nights in Central Cheshire Integrated Care Partnership. Both are in their mobile offices in their car. The roles of community nurses are vast and diverse, from long-term condition management to acute care intervention, from supporting a young person to be independent with their diabetes management and insulin, to supporting families at the end of life. Community nurses are part of our front line and have delivered exceptional care to patients during the pandemic, leading infection prevention and control to support COVID response and vaccination as part of our COVID recovery. I want to share with you 3 examples of student nursing experience, but I do have many more to share. My first example is that of Parish Nursing Ministries UK. Parish Nursing is a charity whose registered nurses work through churches, Christian organisations, to help people of all faiths, including those with no faith, and local communities to gain optimal health and well-being through education, advice, advocacy, referral and spiritual care. You will see on the slide Sarah Mail, a parish nurse with her student nurse on placement. I'm sure they're smiling behind those masks. Parish Nursing offers spoke placements to nursing students. And as you can see from the slide, the feedback provided to me from Parish Nursing regarding the student nurse on her final placement. If you are interested to find out more about Parish Nursing, have a look on their website. The second example comes from Jackie Walker at Cambridge and Peterborough NHS Foundation Trust. This organisation provides community mental health and learning disability services in Cambridge in England and specialist services across the east of England and nationally. Since last summer, they have supported 197 students in the community, delivering almost 500,000 contacts. During COVID, Jackie Walker published an article with the Royal College of Nursing about virtual clinical placements when practice-based learning goes online. During this article, Jackie talks about supporting the student learning environment through an array of information on their online learning platform, showing the value that they place on future generations of nurses. Jackie invited Nima Young, who is a member of our National Shared Professional Decision-Making Council, to speak with students about her role as a community nurse. The feedback from the nursing students is clear to see here. They have evaluated the learning experience and provided feedback. They say a good way to practice the management skills which are required in community nursing. My third example is from Mid Yorks Hospital NHS Trust, which runs Pontefract Hospital, Pinderfield Hospital in Wakefield and Dewsbury, and District Hospital and Community Health Services in Wakefield, all in West Yorkshire in England. In the middle of the photo, you will see Debbie Newton, a Director of Community Services, who praises her community nursing teams, who put in a lot of effort into supporting the students and making sure they have a good experience so that they want to return to community when they qualify. She says, I am really proud of the way that placements are managed, especially considering last year and the pressure the teams are under in delivering services. You can see from the pink and purple boxes which show the positive student comments. Community nursing across England have continued to support placements for student nurses in community. And there are so many examples across NHS continuing healthcare and many other settings. Lastly, I just want to say we are building engagement for a national community nursing plan. It is a plan for all of us, and we are looking to co-produce and co-design this with you. As such, we are using all mechanisms across media platforms to reach and connect to community nursing and students. Here are some incredible Twitter posts, but there are so many more. Please get involved. We would love to hear your thoughts and your wishes for community nursing for the next 5 years, and for you to get involved in our Community Nursing Practitioners Network. I would now like to share with you a video that we made of community nurses telling us what they are most proud of during COVID. Thank you.
I am proud how we work as a team during the COVID-19 pandemic and how we kept our patients safe. In the beginning, we were unsure and worried. However, I am glad that we pulled together as a team to keep our services running. We had redeployed staff from other services, and this was a great learning experience for all of us. Thank you.
What I am most proud of during COVID is the way teams have integrated and worked together within the community with health, social, the third sector and voluntary services to support people to stay at home and live independently and safely. During COVID, it has been devastating and challenging, but the way teams have really integrated together has been humbling, and I am very proud to work within the community of Warrington.
I think one of the most important things for me that's come out of this pandemic is that it's united and unified so many people who weren't originally working in healthcare or have no healthcare background in understanding and preparing and doing what's necessary to help fight infections, in this case COVID. So that's probably the prime factor that I've learned from the pandemic. It's unification of people across the world in fighting infection.
What I'm most proud of during COVID is the work of children's community nursing teams who carried on our hard work in supporting early hospital discharges, preventing hospital admissions, and balance that with keeping everything as normal as we could for children, young people and families who were shielding at home. We may be a small workforce, but we've shown we are mighty, and we want to carry on raising the profile of what we do so that we can future-proof our services.
I am so proud of the way the District Nursing Service so quickly and readily adapted to ensure the safety of ourselves and others, whilst we continue to deliver the same high standards of care to our patients in the midst of a pandemic.
What am I most proud of during COVID? I think for me, it's the kindness that I experienced from the community of Dorking, where I live and work. A community that, despite being behind closed doors, staying safe and keeping at home, made us feel really appreciated. Those dark days where we really had to dig deep to find the strength to work were brightened by the rainbows in the window, the smiles and waves from afar, and the applause on the Thursdays. Thank you, Dorking. Thank you for your kindness.
What I'm most proud about working through COVID is just how resilient the district nursing teams have become. Our workload has become massive, and we've had to support other teams, other areas, and each and every staff member has stepped up and worked so tirelessly to maintain the safety and independence of patients wanting to stay at home and supporting families in such challenging times.
So the biggest thing that I'm proud of over the last few months is my colleagues, the way that we've pulled together. We've all needed to do some scary things, some things that we weren't particularly used to doing maybe. We've done some interesting things and some fun things and had some real successes, but we've really pulled each other through and got each other to the other side, and that's what I'm really pleased and proud to be able to say.
I know the pandemic has caused many people, many patients, many relatives so much of distress, but I take great privilege in helping those patients and relatives out during the horrible times. We had half working from the office and half working from home, and it makes me really, really proud to be part of the team.
Thank you. What a wonderful tribute by our community nurses, and thank you all for your hard work during COVID. You are the rainbow in somebody's cloud, as Maya Angelou says here. Thank you for taking the time to listen and to join in to talk about nursing students, a community in you. And it is my pleasure to hand over to our third presenter this evening, Dr. Crystal Oldman, CBE. Thank you.
Thank you so much, Sam. And hello, everybody. And good evening. A joy to be here. My name is Crystal Oldman, and I'm the Chief Executive of the Queen's Nursing Institute that you've just heard about. And the QNI, I'm so proud to say, is the oldest nursing charity in the world. And as you can see on the next slide here, is a warm welcome from some of the nurses working in the community who want to give you their huge welcome to the family. And Sam mentioned the family of nursing in the community, whether that's as a student on placement or when you choose to have your first job in the community as a newly qualified nurse. And at the QNI, we also often talk about the community as being a big family. And we have a huge range of skills and roles and careers in the community. And I'm going to take a few minutes to share a little bit about some of those careers this evening. But first of all, let me tell you a little bit about the Queen's Nursing Institute and how the importance of training and education to work as a nurse in the community first started. As with so many great ideas in nursing, it started with Florence Nightingale, who helped her friend and philanthropist, William Rathbone, to set up the first training school for nurses to get them ready to work in the community. And that training school was in Liverpool. And so the QNI was born. Together in 1887, Florence Nightingale and William Rathbone had the vision to provide everyone with skilled nursing care in the community, regardless of the ability of people to be able to afford it. So remember, this was more than 60 years before the NHS was established. So we, as nurses, had a vision for district nursing in the community and addressing inequalities in health and improving the health of individuals, families and communities, just as we all do now as nurses working in the community. That's the philosophy and a vision which we have at the QNI, and you'll see it when you're on placement or when you're working in the community. So here tonight, there's an opportunity for you to think about a career in the community, working in any one of a number of roles, serving the local population. And here's a picture of Carol Webby-Brown. She's working in a GP practice. She's one of our Queen's nurses, and she's a highly skilled nurse. And here she's delivering immunisations to children as part of the childhood immunisation programme. And you can also see that the photo is taken pre-COVID without any PPE. And we've got so used to seeing photographs of everybody with PPE, masks and so on. But you'll notice all of the photographs that I have on my slide are all taken pre-COVID. So nurses serve every member of the community all through life, from the beginning to the end, at all ages and at all stages of life. On placement with a health visitor, you'll see the skills of caring for families with babies and young children, assessing health and social care needs of every family member, and focused on interventions and actions to give all children the best start in life, maximising their potential and reducing health inequalities. And if you have a placement with a school nursing service, you'll witness the fabulous nursing work in preventing ill health and again, maximising the potential for all children and young people to thrive and live a healthy and fulfilled life. School nurses undertake a lot of mental health work with young people, a lot of preventative work, a lot of safeguarding work, and you'll be inspired by the creative ways in which they use their nursing skills and knowledge with children and young people. And if you're placed with Community Children's Nursing Service, you'll see some highly skilled nurses leading services for all the children in the area who require nursing care at home. All of the children supported by this fabulous nursing service will have complex conditions and sometimes, sadly, life-limiting illnesses. And the nurses will have long-term relationships with the children and all the young people and their families, supporting them right the way through to a transfer to adult services when the time is right, to the community district nursing services, or sadly, providing nursing care at the end of their lives. It is indeed a very special role. Having a placement with the Community Mental Health Service will provide you with an amazing insight into the work of this nurse-led service, providing care after discharge from inpatient services in a hospital or after referral from GP services and other professionals in the community, keeping individuals safe at home in their communities and able to access all mental health nursing interventions and additional therapies and services. That's a major part of the community mental health nurses' role. And more than 50% of all mental health nurses work in the community. So this is a clear career option for many. And also community learning disability nursing services too. These are also nurse-led services in the community, providing nursing care to some of our most vulnerable individuals, sometimes in residential settings, sometimes supporting and working in partnership with wider family and carers. They're also focused on health and social care. Community learning disability nurses work with the wider community nursing services to maximise physical health and the emotional and social well-being of people of all ages with a learning disability. And now probably one of the most well-known of all nursing services in the community is the district nursing service, providing a wide range of nursing care in the home, caring for people with long-term multiple complex conditions, including complex wound care, diabetes, stroke, heart disease, multiple sclerosis, Parkinson's, every type of cancer, preventing deterioration, managing palliative and end-of-life care for adults of all ages, and also supporting their families and carers. And general practice nurses, providing a nursing service in the GP surgery, another great place to have your placement. Nurses having their own clinics of patients, managing long-term conditions such as asthma, COPD, diabetes, providing screening such as cervical smear tests, and also immunisations for children and for adults. Many also provide wound care clinics and walk-in clinics for minor illnesses at their surgeries, and senior general practice nurses lead and manage wider nursing teams. I think it's also worth a mention right here that general practice nurses have given the majority of the COVID-19 vaccinations in their local surgeries and also in their health centres, and many of them have also contributed to the community-based vaccination centres. And there's a less visible nursing service like the homeless and inclusion health services, providing nursing care for rough sleepers, for those in hostels, for travellers, gypsies, Roma, and families and children living in temporary accommodation. Some of the services offered are outreach on the streets, and others are in hostels and clinics where all health and social care needs, including housing, are addressed by the nurses. And these make fabulous placements for your learning, as well as a fabulous career. The pandemic has shone a light on another nursing-led service in the community, the care home nursing service. Here, nurses are providing complex care to people, often those who are older, but also some specialised care home services, for example, those with spinal injuries. Having a placement in a care home setting will support you to develop your nursing skills and an approach to personalised care. You'll witness complex care, including end-of-life care, and it will give you an insight into a career like no other in adult social care. So I've just highlighted a few of the nurse-led services in the community where there is excellent learning opportunity and fantastic early career opportunities. Straight from qualifying into the community is a wonderful opportunity. And in the community, just so that you know, I think Sam mentioned this too and showed you a photograph of snow. In the community, you'll be working in all weathers. And in every city and every town, there are nursing services. I said nurses were everywhere, right from the beginning to right at the end, from cradle to grave, from sperm to worm. Nurses are there in every city, in every town, and in every village. But you're not working alone. As a student or a newly qualified nurse, you have a whole team wrapped around you. From the highly experienced qualified team leaders, those photographs that I've shown you are all team leaders, experienced nurses leading their teams in the community. And from a qualified team leader to a staff nurse, and also a number of healthcare support workers that will be supporting the team. As nurses working in the community, you're supported by other services too within the multidisciplinary team, and often the office base can be with GP colleagues. And with healthcare, with allied health professionals in a GP surgery or in a health centre. And the pandemic has accelerated the ways in which nurses in the community are using digital facilities, keeping in touch with patients using mobile devices, supporting self-management, using telehealth and remote monitoring wherever possible. And again, you'll see this on placement and learn about the ways that digital technology is really helping and supporting people with self-management at home. So we're delighted at the Q&I to be working with Health Education England and NHS England, NHS Improvement in supporting student nurses to get the most out of their community placement opportunities. One of the actions we took at the outset of the project was to create a survey. We wanted to speak to nurses, nursing students. We wanted to know what it is that nursing students want from a placement. And we have student nurses and newly qualified nurses on our project advisory group. And a survey, we looked at what sort of community placement students were experiencing and what support they might need to maximise their experience on placement. And whilst we haven't analysed the full survey yet, you can see, and you're the first to see this, we haven't released any of this yet, over 1,000 nurses, student nurses completed the survey. And you can see that all fields of nursing are represented there, from those who responded, adult, mental health, child and learning disability, probably reflecting the overall proportions of those in training at the moment. And you can see here the headlines of the survey. So what I've highlighted there is that sadly, not all students, even by year 3, have had a community placement. But those who have said that they would consider a career in the community. 45% said that they would consider a career in the community, and 34% were undecided. 34% of some of those reflecting student nurses who hadn't yet had a placement in the community. Now, the remainder said, there are about 20% who said they wouldn't consider a career in the community, and that's okay too, because we need nurses to be working in the hospital. It's not a competition, we're all part of the same system. But what we do encourage is for all nurses, all student nurses, to have an experience of nursing in the community, because even if you spend your entire career in the hospital as a qualified nurse, it's really important that you've understood where your patients live before they come into the hospital, and where they're going home to, and what great services there are that you're discharging them home to. What the students also said in our survey was something about the great role models that they had in the community and the great learning on the placements that they had. So that's really encouraging. And the students have told us what they'd like on the Q&I website. If they can't have a placement of every type of nursing service, they want a quick insight into the services. So here's an example on our Q&I website of a day in the life series. So it's written by nurses in these roles specifically for students, and each one is on one page, easy to read and easy to digest. And students also asked us, so how do you become a district nurse, for example, or a general practice nurse, or any one of those team leaders for service that we've covered tonight? And that's also on our website, and we've also ensured that's easily readable and all on one page. And our student and newly qualified nurse advisors on the project said that we needed some myths busters, as there's so many myths perpetuated about a career in the community, such as not being able to get a job as a newly qualified nurse in the community, which is just plain wrong. So we have a series of myth busters on the student pages too. We've got blogs written by student nurses and by newly qualified nurses. So please do check out our website and see what that potential is for you on placement and for you as a newly qualified nurse. I'm going to finish with a short video, which we were really grateful was funded by Health Education England last year, and we launched it last year. This extract is just over 2 minutes long. We have a longer version of around 20 minutes, which is really worth seeing. This video is of real nurses working in the community, delivering real care in people's homes and communities. And as always, my thanks to the nurses who allowed us to film them at work, and importantly, to the patients and their families who permitted us to bring a camera into their homes when they were at their most vulnerable.
There we go.
I'll be all right in a minute.
Head up, bum in.
I love my job. I don't think there's any job quite like nursing in the world.
My colleague said to me, why do you want to be a community nurse? And I said, well, because I want to be able to spend more time with my patients. I want to do a varied job. I don't want to be on the same ward every day. I like spending time and getting to know people.
I've not only developed more since I've come to the community than I ever did in hospital. I've got a lot more skills than I ever did. It's completely changed my perception of district nursing.
Sometimes the nursing aspect is not what is worrying the patient, it's a psychological aspect. You know you can talk to me. Go on. Fire away.
Oh no, I mustn't.
Yes, you must. Go on.
Yes, there are parts of the job that are tough, quite emotionally, because we are dealing with patients towards end of life as well. But we have fun days, like today we go to an exercise class and it's not all doom and gloom.
I wouldn't want to do anything else. I wouldn't want to do anything else. I get up in the morning and I'm ready for work.
There need to be more district nurses. You know, we need more. This is called primary care. We can't manage without hospitals, but absolutely you can't manage without district nurses.
So I'm going to bring Liz, Sam, Crystal. Are you with me?
Yes, I am.
Yes.
Yeah. Listen, ladies and gentlemen who are watching, I've been reading the comments throughout, and I've seen dozens and dozens and dozens of questions. So I go straight onto the Q&A. So for the live Q&A, as you know, the way it's going to work is if you've got any questions, you've asked many questions, the audience has asked many questions throughout, please do keep them coming because we're going to try and get through as many of them as we possibly can. If we don't get through to your questions specifically today, then the way that it works is we download all of the questions that come through in the chat. We pass these on to Crystal, Sam and Liz, and then we'll get responses, written responses to those, and then we'll create a PDF where we'll put that onto our website alongside a copy of the presentation where you'll be able to download the slides, you'll be able to watch it again, and you'll be able to get see the questions or see the responses to the questions that we didn't get through to this evening. But we do still have some time if you want to put through some questions at the moment. My very first question, though, is just from me to each of you, and we'll just go round. On my screen, I've got Sam, then Liz, then Crystal. So that's the order we'll do it in. It's obviously very clear to me and to the audience that you're very passionate about nursing in general, and it's been great to see some of the videos that we did get to see this evening and seeing the real eclectic mix of people that make up the UK nursing community. My first question is, you're obviously very passionate about nursing in general, especially passionate about community nursing. Sam, for you to start, how did you get into community nursing?
Thank you. Great question. So as I said in my presentation, I had the opportunity to have a placement in community nursing as a student. I did my student nurse training up in Newcastle at Northumbria University, and I had a placement with a mentor, a lady named Pat Fraser, who was a district nurse, and I just knew from that moment, I knew from the moment I had my first day with her that this is what I wanted to do when I qualified. And I was very fortunate at that time when I qualified to apply for a community nursing post. And the manager took me as a newly qualified nurse, which was a bit unheard of 20 odd years ago, but we're definitely doing that now. So that's all good news. Thank you.
Brilliant. And Liz, what was your sort of route into nursing?
Into community nursing.
Yeah.
My first role was actually nursing in a care home, and I took up that role while I was raising my son, and absolutely loved it, and got a real taste for looking after people in the context of their community and their own home. And then I was really fortunate enough to be able to work within community hospitals, which again are hubs of the community, with inpatient beds, outpatient services, district nursing and health visiting services all around that one building at the centre of the community. Now they're really special places, really special roles. And then I was lucky enough to be director of nursing of a community provider, which had a host of services from sexual health to prison health care, district nursing, health visiting, school nursing. So I was really fortunate to work with some really amazing community nurses who were just inspirational.
Brilliant. And what about yourself, Crystal?
So I trained that long ago that unlike Sam, although you said you had difficulty being newly qualified nurse going straight into the community, not permitted. But when I was training, I had the most wonderful experience of having a sexual health nurse who came to give us a lecture. And she was absolutely superb. And I thought, I want to be her. This is my role model. And partly because she was leading a nurse-led service, she was doing her own thing. And she was like no other nurse that I had ever met in the hospital. So it was always my aspiration to go and be that sexual health nurse. That's not what I did in the end, because I had to stay in the hospital. Please, Mythbuster, you do not have to do that now. I had to be 2 years in a hospital. I became an ITU specialist nurse. And then when my 2 years was up, I was able to go and train as a health visitor. So one step away from being a sexual health nurse, but absolutely that autonomous nurse who was in charge. And I was very happy being an autonomous independent practitioner.
Brilliant. So I think the one thing that you all clearly have in common is a role model that you found while out on some sort of placement. So I guess that, and the reason I thought I'd ask that actually is because I saw a lot of comments about people saying that they've gone out into the community and they've worked with amazing nurses. And so if you're one of the qualified community nurses that is working with us this evening, just keep up the good work, because all of the students who are joining us this evening clearly very much value and appreciate what you are doing. So that's it from me. I'm going to go on to the questions that we've had in from the audience. So the first question is for you, Crystal, and this is, I'm considering a career in community nursing when I graduate, and I have been told that I need surgical / medical experience on a ward before working in the community. Is this true? And I have a feeling a myth buster is coming up here.
Yeah, please check out our website. It tells you it absolutely in writing on our website that is not correct. And it was in the days that I trained a very, very long time ago. That used to be that you had to work in the hospital first before you came out into the community. That is not true now. And it's something that unfortunately has perpetuated from a few decades ago. But it's not right. If you get told, if you're listening to this and you are getting told either in the university by your tutors or when you're out on placement in the hospital and you're being told you can't go into the community, it's absolutely not right. And you'll see that there are many, many jobs coming up for newly qualified nurses with provider organisations absolutely wrapping their arms around you, giving you a fantastic induction programme, fantastic preceptorship. So no, that's not correct.
Thank you very much. Liz, the next question is, this is for you. So this is, do I need to have additional qualifications if I'm looking to work as a general practice nurse in the future?
Oh, what a great question. General practice nursing, an amazing role which provides real opportunities for nurses, both from when they've just joined the register right through to advanced practice, caring for people across the whole age range. So anybody as a newly qualified practitioner taking up that sort of role should expect a period of preceptorship and of course get to spend time getting to know their team, the patient population that they're working with, and the wider community. And actually anybody that's thinking about this, the QNI provides some really useful resources that will support anyone looking to transition into a role in primary care. There are programs that you can undertake. There's a Fundamentals of District Nursing. There's an SPQ in general practice nursing offered through the universities. And you will also learn new skills working alongside really experienced practice nurses. And actually, as careers progress, many choose to specialise and working into nurse-led services, developing their skills and knowledge, caring for people with long-term conditions, for example. So absolutely, there are lots of opportunities to study, to advance your career in general practice nursing, but also you will learn so much just working alongside really experienced nurses.
Yeah, thank you, Liz. And then to you, Sam, for the next question. This is, somebody says, the district nurses I have met are very experienced. Are these roles only suitable for nurses later in their career?
Oh, that's such a great question. Thank you so much. Just to make you giggle a little bit, when I first went into community nursing, and I think I was about 21, somebody asked if I was moving into that role to retire. So there was a myth that you only moved into community nursing towards the end of your career, and that is absolutely not the case at all. So it is a very dynamic and busy and brilliant career. So, you know, there is lots and lots of opportunity to have to go into community nursing early career. You can take up a community staff nurse post, you can work in different services, you can explore different types of community. Many community organisations have set up rotation placements as a qualified nurse, so that you can experience social care, you can experience community hospitals, as Liz was talking about, you can work in some specialist services, you can even have the opportunity to experience research, and there's some fantastic work that is happening around community nursing research. So there's a whole family there that you can explore. And what I would say is kind of follow your passion, and if you have a real passion around respiratory, for example, then follow that pathway and learn and grow and explore. But those posts, you will grow with those posts, and there's plenty of opportunities for a career to stay within community nursing, as I have for 20 odd years. So there's lots and lots of opportunities for you to grow and diverse. And if you love teaching or education or research, as I mentioned, you can still have the opportunities to undertake those as well. So it is extremely varied, and yes, experience in many ways, and the opportunity, as Liz said, to further your education as well as your experience in practice. Thank you.
Thank you, Sam. Lindsay asks the next question, and I feel that this is something that each of you should have at least one sentence as a reply on. So I'll do the it doesn't make sense to the people at home, but the way I'm looking at it, we'll start with Sam, then Liz, and then I've got Crystal down in the bottom. So the question is from Lindsay. So thank you, Lindsay. I just secured my first job as a community nurse. I can't wait to start. Congratulations, by the way, Lindsay. Any tips for a new starter? Sam.
Wow. Oh my goodness. So many. So I would just bed in and enjoy and immerse yourself into the role, get to know your team, get to know your surroundings, because you might not know the community in which you're working with. I can't even tell you how many times I've got lost trying to find care homes or patients' homes or different places in communities. So and just really open your heart and open your mind to learning, and enjoy your preceptorship period. Yeah.
Thank you. What about you, Liz?
Well, first of all, congratulations. And I think it's only human that you will be nervous, you'll be anxious, there will be lots of new things to take in. But don't be afraid to ask questions. There will be people around to support you. So just soak it all up, absorb it. Don't worry that you don't know everything. You will learn, your knowledge and skills will develop. And please don't be afraid to ask for help.
Thank you, Liz. And Crystal.
Yes, and again, my congratulations. You've chosen the best job in the world, obviously. And I would say go check the QNI website out. We've got some fantastic resources to support you there, including a resource document which is called Transition to Community Nursing, which will support you, your independent learning, as well as all of that support that Liz and Sam talked about, and enjoy fantastic career that you're going to have.
Thank you. So I got from that, get to know your team, enjoy yourself, and make sure you've got sat nav.
Absolutely. Yeah.
Liz, this next question is for you. This is from Jenny, and this is, I'm a staff nurse, but interested in how nursing and student learning and development differs in the community to in the hospital environment. How easy is it to move from ward-based to community nursing?
Oh, thank you for that question. That's really interesting. And we do get lots of questions about people looking to transfer. And as we've already talked about, the QNI have got lots of information on their website to help you with that transition. There are lots and lots of skills that you will have developed and knowledge that you will have gained that is equally transferable into the community setting. So it is absolutely possible to make that transition. It's a case of looking at the variety of roles and see which one that you think would fit with you. Recognise that you will have some things to learn. It is very different looking after people in the context of their own home and their own community. but you will have lots of transferable skills. And I'm sure if you make that transition, you will have a job that you will love.
Thank you. The next question, it says it's for Sam, and it's from Famida, which is, how can I start a career in community nursing? And I think we've probably touched on quite a lot of that tonight. So I'd say that unless you want to specifically come back with an answer for that, I think we've talked about resources that are available on the QNI website and various other things. So if you're happy for me to just say that's where we should direct this person, unless you've got something else you want to add to that, Sam.
Yeah, I think if anybody is struggling, there's the community nursing email address that I put on the slide. So I know that's been put in the chat box as well. So, I don't want anybody to struggle. So if they are needing any additional support and help, then we're very happy to help them.
Yeah, and once we get offline, we'll have a chat about how we can support the campaigns that you're running as well around the community nursing. So that's something that the Journal of Community Nursing can absolutely help with.
And Alex, I'd also say there's the opportunity before even thinking about applying for a job is to go and shadow a nurse working in the community for a day. And reach out and as Sam said, I'm sure Sam that the inquiry email will be able to help with that, to put the person who's just asked that question in touch with a local community provider that can provide them with the opportunity for shadowing for a day or two.
Yeah, and for those of you, there's been quite a few sort of links and email addresses and Twitter handles and things mentioned throughout the presentation, and we'll be putting links to all of those things in the chat box, and they'll be available. Don't forget, as part of the presentation, which you'll be able to get access to after this event. So do take a look at that once we've finished. The next question is from Francis. And I think this is probably another one for everyone, but we'll do reverse. So we'll start with Crystal this time, just to mix things up. And this is, how do we showcase our job in the community and attract newly qualified nurses, given how even within the trusts we work, our roles can be misunderstood? So this sounds like it's from a qualified nurse at the moment, sort of talking about how do we get those students and other nurses into the community. Yeah.
Yeah, I absolutely agree. That's something I absolutely recognise. And one of the things that I would suggest is developing a relationship with your local university and having the opportunity to go in, a bit like going back to my original, what inspired me to even know that there were nurses out there in the community, because I never had a community placement as a student nurse. And that sexual health nurse coming in and talking about her role inspired me. So that's one way of speaking to students about your role and about the services and getting them inspired to think about a job in the community.
Yeah, and Liz?
I think building on what Crystal said, actually you are your own best advert for your services, and a really good way of attracting people in is by providing really good student placements. We know that if a student goes in on a placement and has a really good experience, that absolutely influences their choice of career when they graduate.
Yeah, I think that's how we started as well, isn't it? Talking about sort of role models and things like that. Sam, what would you say to that?
I would say, similar to my colleagues here, about celebrating the depth and breadth of community nursing and, articulating that in every space possible. So to commissioners, to finance colleagues, to strategy, to media, on social media, do some blogging, day in the life on Crystal's QNI website. So really, let's promote, publish the work that you're doing and really make it obvious that actually community is a great place to be, and it's well written and well published and well known about.
I think 3 great answers there. So hopefully, Francis, that gives you something to think about. We're on to one of our final questions. We're running slightly over, but I think that's fine because obviously we had that technical issue. So as long as you don't need to rush off anywhere over the next couple of minutes, we'll just get through to this next one or two. So Crystal, I'm gonna ask you this one for now. Do you get any support working in the community, or are you just handed a list of cases and told to get on with it?
Oh no, it's never like that. Absolutely not. So when you first go to work in the community, we have talked about induction, we talked about preceptorship, and that period of preceptorship, around 6 months of being supported. And so you would never be sent out to see people in their own home without that support, without spending time with other qualified nurses in your team, with learning on the job, learning the job with those experienced nurses, and then being absolutely confident that you are able to do that on your own before you're then let to go with your list to see your patients. So, and you don't, I talked a lot in my presentation about complex care. That's the team leader will be undertaking the complex care. And that's why there's a possibility for all nurses from newly qualified through to those highly experienced and qualified nurses who are the team leaders to take care of people with all levels of need in the community. So as a newly qualified nurse, you'd start with the most straightforward and simple. And as Liz said, building on the skills that you're bringing, that you've learnt on your nursing program, or if you're transferring from a hospital, that you've learnt in the hospital environment or another environment.
Thank you. Well, listen, I'm the MD of the Journal of Community Nursing. So, you know, I'm very, very passionate about community nurses. My sister-in-law is a community nurse. She's a district nurse that came straight out of qualification, straight into the community. I've got a friend of mine, Adam, who's a second-year nursing student watching this evening, who's desperate for a role in the community. And so, you know, we want to support community nurses as much as we possibly can. I just want to thank the three of you who've obviously got so much experience, so much knowledge and passion about all roles within the community. And I want to give a huge thank you to everybody who's joined us and watched the session this evening. Hopefully it's given you a lot of things to think about. If you're a qualified nurse already working in the community, how you can support newly qualified nurses or newly qualified nurses and students coming through. And if you're a student, hopefully it's given you some food for thought as to what type of career out of the myriad that are available within a community setting that you might wish to embark on once you are qualified. And we wish you absolutely every success and good luck with your long and fruitful lives in nursing. Sam, Crystal, Liz, thank you very much for joining us. Thank you to the QNI in particular for supporting this event. And a link to download certificates of attendance should be available on your screen at the moment. We'll be back soon with another Facebook Live event. So keep an eye out on our Facebook page. Do like our Facebook page, and then you'll get automatic updates as to when we are going to be live with our next events. It just leaves me to say thank you to my team. Thank you to Mole Digital, who have been working behind the scenes on the event this evening. And have a good evening. And we look forward to welcoming you all back very soon. Goodbye.